The aim of this Lightboard video is to go through the radiographic appearance associated with magnetic resonance imaging or MRI scans. This is a follow-on video to the CT radiographic appearance. And just as a note of caution, please remember that when we're referring a patient to have an MRI scan, it's usually in the case of pathology or interpreting pathology. MRI is not very good for trauma analysis due to the contrast or the low contrast associated with bone. So just a quick overview of the basics associated with MRI. So in terms of the physics principles, we're looking at the radio frequency waves, as well as magnetic fields associated with the scan. So why this is important is when we're looking at MRI, we're not actually exposing the patient to radiation. Instead, what we're looking at is the hydrogen atom concentration within a particular soft tissue. So the difference in contrast, so the grayscale value or the grayscale color, is then correlated to the variation in hydrogen protons or atoms within a particular tissue. So for example, bone is going to be devoid of hydrogen atoms. As a result, it's going to have a low contrast. And tissues such as fat are going to have an excessive amount of hydrogen atoms and water content, so they're going to have a high contrast, or they're going to be brighter. So as how we spoke about with CT scans, there is specific anatomical terminology or radiological terminology that we use to describe the contrast associated with MR. Before we go into this, I just want you to be aware that there are different pulse sequences, or what we refer to as relaxation times, associated with the scanning protocols of MR. And these protocols or parameters need to be set before the patient gets scanned. So you would have come across the terms T1 weighted MR or T2 weighted MR, and this is exactly what I'm referring to. So in a T1 weighted, so if we just write, so we have a T1 weighted MR, and this is going to be our stock standard imaging protocol for anatomical imaging. Our T2 weighted MR, on the other hand, is going to be more relevant for pathological imaging. So when we're looking at the presence of tumors or edemas, this is going to be more relevant. So up on the board, I have an image of a mid-sagittal brain MR, and this has been scanned using a T1 weight. So as you will notice, the fat or the superficial fascia surrounding the patient, which is going to be representative of the skin, is a bright white structure. Meanwhile, bone, for example, is going to be completely black, so we say that it's void. So this has given you a bit of an indication that there are specific terms that we'll use to describe these colors like we did in CT. So just bear in mind that we do not use the terms radio-opaque, radiolucent, or semi-radio-opaque. Those are only specific to CT and radiographs. So firstly, when we're describing structures that are bright white, we say that they have a high signal intensity. So a high signal intensity is referring to the brightest of structures, but what this means in terms of the hydrogen atoms, it means that we have an excessive amount of hydrogen protons in a particular structure. So essentially they have more water or more fluid within them. Specifically for a T1 weighted MR, this is going to be most sensitive to tissues such as fat and bone marrow. When you see a grey tissue type, we say that this is an intermediate signal intensity. So an intermediate signal, we're going to have an adequate amount of hydrogen atoms. So there's an intermediate signal that is being emitted from the tissue. This is going to be any structure that presents as a grey colour. So intermediate is going to be more about dark grey. We can also say that we have a low signal intensity, which is going to be the darkest of greys. So there is a gradient scale that we're referring to. For T1, intermediate tissue types are going to be any sort of soft tissue. So for example, in our mid-sagittal slice of the brain, so any organs, any muscles, and then certain types of fluids. And then lastly, you'll hear the term void. So when we have a void signal intensity, this means that no signal is actually emitted from a structure. So as is the case in bone, for example, because bone has a really high density, it doesn't have a lot of hydrogen atoms within it, so it doesn't have a big water content. As a result, it's not going to emit any signals and it's going to appear as black. So in both T1 and T2, bone is going to be black. So just another thing to keep in mind with the void signal intensity, they don't actually have any or very minimal hydrogen protons. Okay, so that's specifically to T1. I haven't put a T2 weighted image on the screen, but just for comparison, recall that I mentioned T2 is more specific or more useful for pathological interpretation. So the reason why this is, when we're looking at the relaxation times associated with a T2, it's actually going to be more sensitive to picking up fluid. So if we just do a comparison over on this side of the board, in a T2, our bright white structures are going to be cerebral spinal fluid. Any pathological indicators that are going to have fluid which have altered proteins. So let's just write this down. So cerebral spinal fluid, any fluid / pathology. So this is why tumors in the brain will come across as that bright white structure. Our intermediate signal is relatively going to stay the same. The biggest difference is that fat is going to appear as intermediate. So this is going to be gray. And then our void structures are going to be relatively the same. So we're going to be looking at bone that is void. I guess lastly, you'll recall that we had comparative terminology associated with CT. We have the same with MR. So the comparative phrases that we use is so remember, not hypodense, hypointense. So hypointense is going to refer to a comparative structure being less intense, so it's actually going to be darker. And we have hyperintense, which is going to be the opposite. So just keeping in mind that when we're using hypointense or hyperintense, we're usually comparing two structures that have the same sort of signal that is emitted. So we'd be looking at two intermediate signal structures and comparing these two. So I hope that provides a bit of an overview of the appropriate terminology that we use when we're interpreting an MRI image. Thank you very much.